people choose their own course. I also want to discuss one other aspect of the program in Chettinad Health City, as far as I can tell, is unique in all of India, and that is how the post-operative time is used. Basically, every hospital allows a 2-week time frame for surgery such as this. As long as everything goes well, a person comes, stays in the hospital 2 weeks, and leaves. They do it a little differently here, and it turns out to be exceedingly more pleasant as well. The time is divided into 2 halves, basically. You come to the hospital and almost immediately have the surgery, and then you have your normal recovery during the rest of the first week at the hospital. If you're feeling well enough, and that is normally the case, you can then go to a nearby beach resort and spend a week there recovering. Just the joy of getting out of a hospital environment really helped me a lot, and it was just much more pleasant to be able to look over the Bay of Bengal and hear animals and see gardens and get on with my program there, which was not that complicated because besides the normal medical recovery, you also got rehabilitation recovery and taught how to use a walker or canes or whatever you needed so that you could function when you left the hospital. To me, this was also a great benefit to the program in Chennai, and I just wanted to mention that. For example, when I first came to the hospital, I met a British man named Chris who had just had hip resurfacing, and he was at the point, he was just visiting the hospital. He had already been ensconced in the beach resort and said it was just great for him also, and he enjoyed being able to walk around outside and said it helped him a great deal as well. At that point in my story, it was decided that I should recover for 6 months before we tackled the left hip, because the left hip was in worse shape than the right hip, as I previously mentioned, and it also required some type of total hip replacement as opposed to hip resurfacing. And what we decided upon is called the proximal hip replacement. The proximal refers to the actual prosthesis. It's a short stem prosthesis which was actually developed in Italy, I believe, and has 2 unique features. One, since it's a short stem, the amount of hollowing out of the femur bone is reduced greatly, and also the design of the head of the prosthesis allows for much greater range of motion after the operation and begins to actually even approach what you can get out of hip resurfacing. Although not quite, but it's almost there. This was also very important to me because I wanted to, after all this is over, get on with being as active as I could possibly be, and I felt confident that this prosthesis, the Proxima, would allow that as opposed to just the normal thing. Also, I should point out it's a metal on metal prosthesis, meaning they have a metal receptor cup into which in the pelvis, and the metal cup of the head of the Proxima is put into that, and it allows for great strength and fine range of motion. So this almost brings us up to the point I am at now, because I just had the proximal hip replacement surgery done. It went extremely well. They were able to put the largest cup sizes in, which translates into the greatest amount of mobility. My recovery has been very strong. I can actually feel already that this could be a weight-bearing leg, although I'm not going to do that right away, but I can feel the differences between the first hip and the second hip, and it's very positive to feel that. I'm now just following the program, which is basically on the website, which gives very clear and extensive diagrammatic videos of exercises you could do, when you should do them, how long you should wait before you do certain ones, and lays out a whole approximately 6-week program of how to proceed. I should mention also that that's all about the surgery that I can think of to say. The benefit of also coming to a resort area is very good. If someone came to help you just get through this as my wife did, it affords the chance of getting to look at really incredible temples that are unique in this area of the world, and just really also get to understand India's culture better and improve the experience in every way. If I had to just sort of try to summarize everything in a short way, I would say what I found in Dr. Venkatachalam is an artist surgeon, not just a surgeon. Is somebody who can really work with somebody, immediately comprehend the minutiae of what is going on with their body, and find the best possible solution for the ultimate result of having the greatest afterlife of mobility and normalcy.
This has been a unique experience. I never thought that my husband having 2 hip replacements would be as interesting and rewarding for both of us. I mean, first of all, to have his surgery done so that we can lead a normal life again. I've gained weight since he's been unable to walk, for instance. So we want to ride bicycles together and go places together again. So this is, we were feeling old and now we feel younger again. And to come to a place like India, to Chennai, to have this done is a wonderful experience. In the hospital, we were treated very well, and we're completely happy with the way the surgery went, and the doctor has been delightful and always a pleasure to deal with. We feel personally attended to, and with a great deal of compassion and caring, and the same continues in the beach resort. And here we have a view, we're right on the sea. We have breezes, there are beautiful colored buildings everywhere, and culture and temples and shopping, and I never expected this. So we're looking forward to coming back again, not for an operation, hopefully this time, but just for a visit next time. We're totally happy. I can't imagine it could have gone better anywhere, even if we could have afforded it in the US or anywhere else where they do such things. So I think we got really the best out of this experience we could possibly get.